Vertigo Teams is the continuation of the Vertigo Primary Care Preceptorship Program. This course is composed of lectures, discussion of cases in different scenarios, and skills training in diagnosing as well as treating common positional peripheral vestibular disorders. Vertigo Teams emphasizes the multidisciplinary approach. Participants include ENTs, general practitioners, internists, emergency and occupational physicians. The main objective is to emphasize the value of an effective referral system in diagnosing and treating vertigo disorders.
I am Dr. Christopher Calacyan, current chair of the Philippine Academy of Neuro-Otology, Otology and Related Sciences, or PANORS. We welcome you all to the Vertigo Teams workshop by Abbott. As we all know, dizziness is a very common symptom not just in our clinics, but also in our emergency room. And half of this dizziness is of peripheral origin, meaning it's coming from the ear. With that, we want to teach all those non-ENTs, the family med practitioners, and even the general practitioners on how to appropriately and correctly diagnose and treat peripheral vertigo. And hopefully, this workshop, although starting small, may have an impact someday in the total healthcare system of our country, the Philippines.
Hi, I'm Kayla Janicio, an otology fellow in training from the East Avenue Medical Center. And this experience is something I'm very, very grateful to have been a part of because even as an ENT physician, dizziness is something that is quite difficult and challenging to tackle. And if an ENT finds it a little bit difficult and challenging, what more the non-ENTs? So this experience is something that had been so ingeniously curated to gather all ENTs, non-ENTs like internal medicine physicians or neurologists and put them all together and then travel all the way to Cebu, to Clark, to Alabang, and finally now here in Seda, Quezon City, so that we can make the whole management uniform and make the management of dizziness or peripheral or central vertigo, in fact, to be more concise and more understandable so that the Filipinos are very well taken care of.
We believe that by supporting programs like this, we contribute to the strengthening of clinical confidence and ultimately improving patient outcomes. Thank you to all our healthcare professionals who continuously advance their knowledge and elevate their standards for care for their patients.
Hi, I'm Doc Mel Cruz from East Avenue Medical Center. I'm an otolaryngologist and an otologist. What I really like about the Vertigo Masterclass is that people are still coming back and they're probably enjoying the lectures that we have for them. Dizziness and vertigo, it's a pretty dynamic and diverse topic that you really need to hear certain things several times to let them sink in. So this year we have a lot of like specialists talking, discussing, brainstorming to give you a comprehensive list of lectures. And I really hope that this continues next year so that we can give a more advanced set of lectures for everyone.
I'm Dr. Carlea from St. Luke's Medical Center, and as a co-facilitator of this event, I am privileged to have met a lot of experts in this field, understanding that dizziness is truly an intricate and complex condition. For the past 2 years, this event offers an excellent opportunity for collaboration and joint effort to help our future patients.
I'm Dr. Aleli Onya, your friendly otology fellow at East Avenue Medical Center. So diagnosing vertigo is really difficult in the other physicians in the clinical practice. So this workshop really helps people to manage and treat diseases effectively and to differentiate the peripheral and central causes of vertigo. It also gives you to identify the red flags necessary in treating urgent patients or patients warranting early intervention. So this workshop will empower all the physicians to effectively manage and treat patients with vertigo.
Hello everyone, my name is Pip Alvarez from Bicol, currently training as an otology fellow in East Avenue Medical Center. So being part of this experience is both an opportunity and a privilege to teach and to learn. So I'm hoping in the future I could cascade this to teach to the rural doctors and to experience what we have experienced here in this workshop.
Hi, I'm Dr. Jonna Ligon. I'm an otologist and I am part of the core group of the Vertigo preceptorship. So being part of last year's activity and this year's activity, it was nice seeing the progression from last year's individual approach to diagnosis to this year's team-based approach to managing and diagnosing vertigo. So this puts a lot of emphasis on the importance on collaboration. So seeing different subspecialties help each other out in managing and diagnosing vertigo is really the way to go. And I hope activities such as this would continue so that we all know we all need each other for managing our patients properly.
I am Dr. Cesar Anthony Yabut. I'm a practicing otolaryngologist in General Santos City. And I would really encourage our young practitioners to attend such fora like this, to be able to learn more about the different aspects of otology, both hearing and balance. This is to improve their practice when they go back into their respective places of practice, because majority of patients that we see in the clinics are coming in for otology complaints. And like I said, it is always a pleasure for me to be able to share whatever I know and whatever I have experienced in the many years that I have been practicing otolaryngology. Thank you very much for giving me this opportunity, to Paynors and to Abbott Laboratories.